skill number 2 of pharmacy science event, and this is verifying the content of a controlled substance prescription and verifying a DEA number. So you will be obtaining a prescription, of a controlled drug, and from there you're going to be verifying the patient information, which is their name and their address, which is up here. Prescriber information, which is down here, name and their address. Telephone number and license number, also known as the DEA. So with the DEA number, there's a way to verify that it's a valid license number and that it is not forged. And so how you're going to do that is you're going to add the first, third, and fifth digits of the DEA number. And then you will add the second, fourth, and sixth digits. Add the sum of the two. And verify that the last digit from this number matches the last digit of the DEA number. Boom. So that is a valid DEA number. From there, you're going to look at when the prescription was prescribed, which is right here. Drug name and strength, which is right here. Route of administration, which is in the SIG, also known as the signature directions. So you'll also look here for the directions of how the drug's to be taken. Number of refills authorized, which is down here. Product selection, that's permitted, which is right here. So this is whether or not we can dispense a generic drug or switch the manufacturer of the drug. So since this doctor wrote dispense as written, we are not allowed to change the brand name to the generic drug. Prescriber signature, which would be on this line right here. And make sure that the SIG code does not contain any dangerous abbreviations that can be mistaken for other drugs or directions.